Yeah, thank you very much. My name is Skovsted. I'm a postdoc at Glostrup Research Institute at Glostrup Hospital. Here you see a heart, and ischemia arises when the coronary artery is narrowed due to either atherosclerosis or vasospasms. If this persists for a longer time, it induces infarction and irreversible change in the tissue distal to the occlusion. Can you hear me? No? I will speak louder then. Can you hear me now? The coronary blood flow is determined by a lot of several factors. In this presentation, I will focus on endothelin. Endothelin is one of the most potent vasocontractile peptides known. It is synthesized and released from endothelial cells, where it mediates its action by binding to two G-protein-coupled receptors, the ETA and ETB receptors. Under normal physiological conditions, the ETB receptors are situated in the vascular in the endothelial cells, mediating a vasorelaxation, whereas the ETA receptors are situated in the vascular smooth muscle cells, mediating a vasoconstriction. We know from several studies that patients with ischemic heart disease have increased levels of endothelin 1 in the plasma. Furthermore, studies from our group have shown that patients with ischemic heart disease have an increased upregulation of ETB receptors in the vascular smooth muscle cells of the subcutaneous arterioles. When the ETB receptors are situated in the vascular smooth muscle cells, they mediate a vasoconstriction as the ETA receptors. Furthermore, a study has shown an upregulation of ETA and ETB receptor mRNA in coronary arteries from patients who've died of ischemic heart disease. So our hypothesis is that ischemia induces upregulation of ETA and ETB receptors, and this might lead to an increased coronary tone, which might impair the coronary blood flow after an ischemic insult. So the first aim was to establish an animal model to study the endothelin receptor-mediated changes after myocardial ischemia. And here I used an animal model in anesthetized rats. I induced ischemia by ligating the left coronary artery. I monitored the rats with the ECG, and here initially you see the normal ECG, and during the ischemic phase we see an ST elevation. After reperfusion, approximately after 30 minutes, we get a normalization of the ECG. I had 3 groups. One group, I induced ischemia for 15 minutes, followed by 24 hours of reperfusion. In the other group, I induced permanent ischemia, and then I also had a sham group. Here you see the rat hearts 24 hours after the operation. And we see the ligature here in the sham group and the ischemia-repurfusion in the permanent group. In the permanent group, we see a clear infarction in the TCC staining, which stains the vital tissue, and there are some diffuse infarctions in the ischemia-repurfusion group. Furthermore, I dissected out the coronary arteries, one segment upstream to the ligature, one segment downstream to the ligature, and furthermore, the right coronary artery, the so-called septal coronary artery. Those vessels are mounted on a wire myograph, where I was able to monitor the contractility of the segments. With serafitoxin 6C, which is a specific ETB receptor agonist, I monitored ETB receptor mediated contractility, and with ET1 in presence of an ETB receptor antagonist, I measured the ETA receptor mediated contractility. The ETA receptors, here we didn't see any changes in the ischemic groups compared to the sham-operated groups, neither upstream to the ligature or downstream to the ligature or in the septal groups. that's what you see here in the concentration response curves. Upstream, downstream, and the receptor. But interestingly, with the ECB receptors, we saw a clear upregulation, significantly upregulation in the segment downstream to ligature in the ischemia-repurfusion group. We confirmed that it was a protein upregulation where we saw an increased density in the vascular smooth muscle cells, and we confirmed that on the Western blot. So to sum up, ischemia-repurfusion induces in the downstream coronary artery an enhanced ECB-mediated vasocontractility and density, whereas we didn't see any changes in the ETA receptors. Well, our next aim was to study which molecular mechanisms are involved in this ECB receptor upregulation. And we did that with an ex vivo model. Interestingly, we found out that when we incubate coronary arteries from healthy rats in a normal physiological buffer, the ECB receptors spontaneously upregulate during myograph studies. So use this as a model to study the ECB receptor upregulation. So in coronary artery, we did 3 concentration response curves after 1.5 hours of incubation, after 4 hours of incubation, and after 7 hours of incubation, and furthermore after 24 hours of incubation. And here you see that in the fresh arteries there's almost no ECB-mediated contraction, whereas it increases after 4 hours and increases 7-fold after 7 hours of incubation. Studies from cerebral arteries have shown that ECB receptor upregulation might be due to transcriptional upregulation, which involves the MEC-ERK signaling pathway. Therefore, I studied whether actinomycin D, which is a general transcription inhibitor, and UO126, which is a MEC inhibitor, was able to attenuate this upregulation. And I found that that in presence of both of these inhibitors, I was able to inhibit the upregulation of the ECB receptors. Furthermore, I studied the p-ERK in the vessels with immunohistochemistry and saw during the incubation that it increased until 4 hours of incubation and declined afterwards. And in presence of UO126, the MEC inhibitor, I was able to abolish this phosphorylation of ERK. The ECB receptor protein level, I was only able to inhibit that after 24 hours of incubation in the presence of UO126 compared to the control group. So in conclusion, ischemia-repurfusion induces upregulation of contractile ECB receptors, both on a functional and on an expressional level. And the MEC-ERK signaling pathway might be involved in this upregulation. So next we want to do some treatment studies on rats to see if UO126 is able to inhibit this upregulation in the rats, and look at the outcome of the rats. So, and then I'd like to thank my supervisors, Lars Edvinsson, Majid Seksade, and Simon, and 2 of my master students. Thank you.